MeRT is an emerging technology that tries to reprogram abnormal electrical signals in the brain. We put a cap on the head and look at where abnormal signals are coming from. We then turn around with that data and use this electromagnetic coil to send electrical signals back in the brain and try to re-attenuate or to wake up or to modulate these brain signals.
I want to open this up to discussion really quickly because as I'm listening, of course, I'm uninitiated. I've never been around this treatment. I've never seen it administered. But I also will look at Lynn and think, wow, sure seems like it's worth a try to me. And that's why I want to ask both you, Lindsay, and also Dr. Miller, how do you go about making that decision? Because what would be the downside to trying it if, as Leigh has attested, you know, nothing else has really helped him get to the place you would like him to get to? So I'll open the floor for your comments on that.
So the downside would be no benefit at all the time you would pour into something like this type of a treatment. Again, 6 weeks, 4 to 6 weeks every day. You know, the downside would really be that there is no effect, which we do have children that have gone through 4 to 6 weeks and get no effect or no change in their behavior. What's interesting to note, though, is that we do have research that currently shows that there are specific EEG changes in a autistic brain. And it's not a new tool by any means, but we're starting to understand how, by utilizing EEG to analyze autistic patients, how it can actually help us understand what's going on in the brain. Because we don't know what causes it. You know, we don't really have a cure for it. None of these type of treatments that we're talking about really are FDA approved. They're all off-label. You know, it's important to understand that. However, like you say, there's really no
Can I ask two questions? How much would it cost, for instance, for a 4 to 6 week treatment cycle?
Somewhere around $10,000.
Which is, and that's an important question to ask because
clinic, you know, so.
The cost is always a downside, right?
Absolutely.
If you get no benefit and you pay for something, that's a downside.
You feel like a terrible person when you know, after somebody has done that treatment and you're, you know, wow, I appreciate what you've been through, but that's a lot of money to say, hey, sorry, it didn't work, you know.
And then I'll bring you back in, Lindsay. It seems to me that a good clinical trial would answer a lot of these questions. Is there one happening? How close are we to maybe being able to say, this is the right protocol, this is how it should be done nationally, if you're going to try this?
Yes, so 2 things. I do not want to give the impression that I don't think this is promising because I've been doing it myself for about 15 years. I do believe in it. I believe that I know we can modulate the brain using TMS to improve functioning of various circuitry. That being said, it's not simply that it may not work, but we may modulate it in a way that makes things worse. And this is, as a researcher, as a parent myself, what I would worry most about. When we talk about risks, yes, there's a very small risk of inducing a seizure, 1 in thousands. However, a bigger risk is that we are shifting the functioning of a brain, especially in a child, a developing brain, that we don't know exactly where it is at this current moment. You certainly can do an EEG, but EEGs change millisecond to millisecond. It is not a simple static state that a person stays in for days or months in an EEG. So we can measure this, but there isn't the data out there that we can confidently say, I know what protocol that may help you. And there is a potential downside is that I may modulate your brain in a way that may not be positive, that may actually lead to impairments or a greater symptom in a certain domain because I'm not sure which way to modulate which part of the brain.
Lindsay, let me ask you this and then we have to take a break. If we've been providing these treatments for 15 years, my curiosity is how come we don't have any trials? That is really frustrating for me.
It is.
Dr. Mill, where are we in terms of getting some really good data so that maybe a few years from now we can say this is the treatment protocol and this is what you should do, and if that doesn't work, then this?
I mean, are you gathering data with your treatment of the patients you're doing?
We keep a data set. You know, every single day that the patients come in, the parents will describe symptoms. We can follow the CARS score, which is the childhood autism rating scale, things like that. But one of the limitations, exactly what you're saying, the limitations is that we don't even have a unified way of measuring what autism is, right? It's a spectrum that doesn't really even have a cause that we know yet. And so that is one limitation. What we would have to probably do is focus more on behavior or symptoms that we're trying to modify and move from there into a clinical trial, and then eventually evolve into, well, when your child has this behavioral change, this is the protocol for it, or this is how we attenuate it. MeRT is a little different in a sense also, even a variation to that, in the sense that we're not really treating a brain disorder. We're treating what we see on the EEG. In other words, we're re-attenuating the abnormalities we see regardless of what the diagnosis is. And so it's a unique type of treatment approach.
And no easy answers here, but what I do want to do is take a quick break, and when we come back, we're actually going to meet a mom whose daughter received this experimental treatment. We'll talk to her when we return.